Hey everyone, welcome back to Visions Beyond for another deep dive. Don't forget to like, share, and subscribe so you don't miss any of our future deep dives. Today we're going to be looking at the connection between PCOS polycystic ovary syndrome and type 2 diabetes. And to help us untangle this complex relationship, we'll be using excerpts from a few sources. Polycystic ovary syndrome and type 2 diabetes mellitus, a state-of-the-art review. Surprising study finds PCOS does not cause diabetes, heart disease, or stroke, and type 2 diabetes mellitus in patients with polycystic ovary syndrome. So get ready because we're about to uncover some surprising findings.
Yeah, it really is an intriguing area, isn't it? For years we've known that there's a link between PCOS and type 2 diabetes, but the how and the why have always been a little bit murky.
Right. It's almost like one of those things where everyone's heard the warnings, but not everyone really gets what it all means. Like, yeah, PCOS can increase your risk of diabetes, but what does that actually mean for you?
Exactly. It's not just about knowing there's a connection, it's about understanding what that connection means for you and your health.
And one of the sources we're looking at today, that groundbreaking study from Cedars-Sinai that really kind of shakes things up. For so long, women with PCOS were told they were at a much higher risk for developing diabetes. It was almost presented as like a foregone conclusion. But this study really challenges that assumption.
Absolutely, it really does. And what I find fascinating about the Cedars-Sinai study is that they used a technique called Mendelian randomization. It's a really interesting way of looking at genetics to determine whether something actually causes something else rather than just being associated with it.
So it's like they were able to kind of isolate the PCOS variable and see what happened without all the other noise.
Precisely. And what they found was pretty remarkable. They discovered there's no direct causal relationship between PCOS and diabetes or heart disease or stroke.
Okay, so that's huge. But what about all the research that shows a connection between PCOS and diabetes? Is all that wrong?
Well, not necessarily. This is where we have to get really clear about the difference between correlation and causation. Just because two things tend to show up together doesn't mean that one actually causes the other. There could be other factors at play, other things influencing both.
Like those hidden variables that can really mess things up.
Exactly. And the Cedars-Sinai study helped to uncover some of those hidden variables. They found, for example, that obesity is a causal factor for both PCOS and diabetes.
Wait, so hold on. This is important. Are you saying that having PCOS doesn't make you obese, but being obese increases your risk of both PCOS and diabetes?
That's exactly right. It's a very subtle but crucial distinction. And it really emphasizes the importance of understanding individual risk factors rather than making these sweeping generalizations.
Got it. So obesity is a shared risk factor. What else did they find?
Well, they also found that elevated testosterone levels and low levels of a protein called SHBG, these were also causal factors for both PCOS and diabetes.
So instead of just assuming that everyone with PCOS is on this fast track to developing diabetes, we need to be looking at these other factors, these other pieces of the puzzle to determine who's truly at a higher risk.
Exactly. And that's where the whole concept of personalized medicine comes in. It's about understanding the unique circumstances of each individual case and tailoring treatment plans accordingly.
It's like having a custom-made suit instead of trying to fit everyone into the same off-the-rack size. This is a huge shift in how we think about PCOS and diabetes prevention. Okay, so we talked about how this whole idea of like diabetes risk is changing, especially for women with PCOS. But how do we actually figure out someone's risk? It can't be as simple as just like checking your blood sugar, right?
Yeah, you're right. It's definitely more complex than that. There are a few ways that doctors evaluate what's called glycemic status, which is basically how well your body is handling sugar. And there's been some back and forth about which methods are the most reliable, particularly for women with PCOS.
Yeah, our source, Polycystic Ovary Syndrome and type 2 diabetes mellitus, a state-of-the-art review goes into some of those different methods. So what's like the standard approach? Where do they usually start?
Well, the most common starting point is measuring fasting plasma glucose, or FPG. It's just a simple blood test. You haven't eaten for at least 8 hours, and they check your blood sugar levels.
Okay, pretty straightforward,
hmm
but it sounds like there might be some catches.
You're picking up on it. While FPG is really convenient, it might not always give you the complete picture. Research suggests that it can miss a fair number of women who have impaired glucose tolerance, or IGT.
Which is basically like a precursor to diabetes, right?
Exactly. It's like that pre-diabetes stage. And that's where the oral glucose tolerance test, or OGTT, comes in. It's often considered the gold standard for diagnosing diabetes because it gives you a more dynamic look at how your body is processing glucose.
Okay, so walk me through this. What's different about the OGTT?
Think of it as kind of like a stress test for your sugar metabolism. So you fast overnight, they measure your blood sugar. Then you drink the sugary solution, and they measure your blood sugar again at certain times, usually 1 hour and 2 hours later.
So they're basically seeing how well your body can handle that sudden spike in sugar.
Exactly. It helps to identify any issues with how your body is processing glucose, issues that a simple fasting test might miss.
And this is especially important for women with PCOS
Because it can catch impaired glucose tolerance in those early stages, which gives you a chance to maybe make some lifestyle changes or consider medication to prevent or at least delay developing full-blown diabetes.
got it. Early detection is key. Now, I've also heard about this thing called HbA1c. Isn't that also used to check for diabetes?
It is. But it's usually used more for monitoring blood sugar control over a longer period of time. Like for people who have already been diagnosed with diabetes, it measures your average blood sugar levels over the past 2 to 3 months.
So maybe not the best tool for initial diagnosis, especially for someone with PCOS.
Right. For one thing, women with PCOS often have irregular periods, and that can actually affect the HbA1c reading, even if their blood sugar control is fine.
So it might not be giving a completely accurate picture.
Exactly. And also, HbA1c doesn't tell us anything about impaired glucose tolerance, which, as we've discussed, is really important for that early intervention.
Okay, so for our listeners out there who have PCOS and are concerned about their diabetes risk, it sounds like talking to your doctor about getting an OGTT is a good idea, especially if you have any of those other risk factors we talked about, like obesity or elevated testosterone or low SHBG.
I absolutely agree. Knowing your individual risk profile is crucial. It empowers you to take control of your health.
Okay, so we know how to figure out our risk,
Yeah.
but what can women with PCOS actually do to manage that risk? Like, what are the things we can actually put into practice?
Well, the foundation is always going to be lifestyle. Those healthy habits, balanced diet, regular exercise, stress management, good sleep, all those things we know we should be doing.
Right? All the things that are easier to say than to do sometimes. But why are these lifestyle factors so important for someone with PCOS who's concerned about diabetes?
Because they really directly affect those key risk factors we talked about earlier. Think about weight loss, for instance. Losing even a small amount of weight if you're overweight or obese can significantly improve your insulin sensitivity.
So your cells can actually start using insulin more effectively and your blood sugar stays balanced.
Exactly. And exercise. Exercise is like a booster shot for your insulin sensitivity. It helps your muscles use glucose better, and that takes the pressure off your pancreas.
It's like giving your body the tools to manage sugar like a well-oiled machine, right?
Exactly. And stress. We can't forget about stress. When you're constantly stressed, your body's pumping out cortisol, and that can wreak havoc on your blood sugar. It makes insulin resistance even worse.
So finding ways to manage stress that are healthy for you, whether that's yoga, meditation, spending time in nature, those become a really important part of managing your PCOS and reducing your diabetes risk.
Absolutely. And then there's sleep, which is often overlooked. When you don't get enough sleep, your hormones go out of whack, your insulin sensitivity plummets, and all of a sudden those cravings for sugary foods, those high-carb temptations, they're so much harder to resist.
But you're setting yourself up for a blood sugar roller coaster.
Exactly.
So having a regular sleep schedule, creating a relaxing bedtime routine, that all becomes part of the equation.
It's all interconnected, And of course, beyond lifestyle, there are also medications. Medications that can help manage PCOS and lower the risk of developing diabetes.
Metformin is one that I hear a lot about. How does that work?
Metformin is actually quite interesting. It's been around for ages,
Yeah.
It's been used to treat type 2 diabetes for decades, and one of the main ways it works is by improving insulin sensitivity. It helps your cells become more responsive to insulin.
So it's like turning up the volume on that insulin signal.
Precisely. And it can also help with weight management and might even have some benefits for hormone balance in women with PCOS.
Sounds like it wears a lot of hats. Are there any other medications doctors might consider?
There are a couple of others, but they're usually used in addition to lifestyle changes, and often for women who haven't seen the results they're looking for with metformin alone. There's a class of drugs called thiazolidine ediones, or TZDs for short. They work in a similar way to metformin, but through a different pathway. And then there are GLP-1 receptor agonists, which are a newer class of drugs. They mimic a hormone that helps regulate blood sugar.
Wow, it sounds like there's a whole arsenal of options available.
Right. But the key takeaway is that it's really crucial to work closely with your doctor to figure out the absolute best approach for you. What works for one person might not work for another. It's all about finding that personalized plan.
Right. This is what we've been talking about this whole time, personalized medicine. And sometimes that plan might involve bigger interventions, right? Like what about bariatric surgery?
Yeah, bariatric surgery can be an option in certain cases. For people with severe obesity and PCOS who haven't had success with other ways to lose weight, these procedures can lead to pretty significant weight loss and improvements in metabolic health, including insulin sensitivity.
But it's a major decision, obviously, with potential risks and complications.
Absolutely. It's definitely not a first-line treatment. It's usually only considered for people with a BMI over 40 or over 35 with serious health problems linked to their weight and who have already tried less invasive approaches.
So it's something to discuss with your doctor if you fall into that category.
Yeah.
Now, before we wrap up, I have to ask about something I see a lot online, supplements. Myo-inositol, omega-3s, all that stuff. Are those worth exploring for PCOS and diabetes risk?
There's definitely a lot of buzz around supplements these days, and some of the early research is really promising. For instance, myo-inositol, which is a naturally occurring substance, it seems to play a role in insulin signaling. And some studies have shown that it might improve insulin sensitivity in women with PCOS.
So another potential addition to that personalized toolkit.
Exactly. But just like with any supplement, it's important to approach them cautiously. And always talk to your doctor first. What works for one person might not work for another, and more research is definitely needed to determine optimal dosages and long-term effects.
Right, safety first. So what about omega-3s? Everyone says they're good for your heart, but do they have any impact on diabetes risk?
Omega-3 fatty acids have those anti-inflammatory properties you're talking about, and there is some evidence to suggest they might have a small positive effect on insulin sensitivity. It's still an area of active research, but incorporating omega-3 rich foods into your diet is generally a good thing.
Okay, so we've covered a lot of ground today. We've talked about how our understanding of the connection between PCOS and diabetes is changing. We've looked at different ways to assess risk and explored a whole bunch of strategies for managing that risk. Do you have any final thoughts for our listeners with PCOS who might be feeling a little overwhelmed by all this information?
Well, PCOS is complex, there's no doubt about it. It can definitely present some unique challenges. But with the right information support and a proactive mindset, you can absolutely take control of your health. Remember, you're not alone in this. And with all the amazing advancements in personalized medicine, there's more reason than ever to be optimistic about the future.
Well, it's been an absolute pleasure diving into this topic with you today.
Yeah.
And to all our listeners out there, thanks for joining us on Visions Beyond. We hope you found this deep dive informative and empowering. And don't forget to like, share, and subscribe so you don't miss any of our future deep dives into the world of health and wellness.